Last chapter for CM, Chapter 21, Factors Influencing Health Status and Contact with Health Services. So those of you familiar with 9, these are our V codes. Sorry, I got to retrain you. They're now Z codes. So we're looking at Z00 to Z99. So again, old V codes, important to remember. I know this is especially important for my beginner coders. This is a really common mistake. These are not procedure codes, even though a lot of them sound like it. So we have, the codes for a patient coming in for an immunization. Well, it's just the diagnosis to indicate that they came in for that, but you have to also code the procedure itself of administering that immunization. So remember that these are diagnosis codes, even though a lot of them sound like procedures. So in terms of guidelines, it's a fairly long list. It just kind of goes through some different categories. So like contact exposure, there's category Z20 and Z77. So we have contact with or suspected exposure to communicable diseases and to hazardous things that are hazardous to their health. So they don't actually show any sort of sign or symptom that they are just suspected to have been exposed to this. We can use these. I mentioned that we have the Z23 if patients are coming in for some sort of prophylactic inoculation, so immunizations, vaccinations, those kinds of things. Our status codes, in the guidelines, there's a pretty long list here. I'm not going to go through the whole list. Status basically indicates a history of or status post. So the patient's either a carrier of the disease or has something that's occurring after this, some sort of residual later. So some examples of here, we have a genetic carrier, Z14, the Z15, genetic susceptibility to disease. This is one that shouldn't be used as a principal or first listed diagnosis. Now, in terms of Z codes, some can be principal diagnosis. We saw a perfect example with the newborn babies. Some can only be additional diagnosis. It just kind of depends on the Z code itself. We see the Z22's carrier of infectious disease. Z79 we took a look at when we were looking at diabetes with the patients that were on insulin. Z92.82 is to document if a patient has status post-administration of a TPA in a different facility within the last 24 hours prior to admission to the current facility. We also have a transplanted organ removal status. Again, there's a pretty long list of these in your guidelines that you can take a look at. We still have our history code, so remember that it is different between a personal history of and family history of. When you're looking these up in the index, make sure you know which subterm you're under, whether you're under personal or family. We talk about screenings. So remember that a screening, we're trying to do early detection for some sort of disease, so like a mammogram, for example. If a patient actually has some sort of sign or symptom that they're coming in to see what it is, it's not going to be a screening. That's just going to be coded as a sign or symptom then. If they do find a condition during the screening, then the code for the condition can be assigned as an additional diagnosis. Observation. We talked about observation codes a little bit with newborns. There's also observations for the rest of us that are not 28 days or less. So these are for suspected conditions that are ruled out, and there's also a Z03.7, which I don't have on the slide, for encounter for suspected maternal or fetal condition ruled out. That is one that can be an additional diagnosis. Typically, your other observation codes are going to have to be your principal or first listed diagnosis. We do still have aftercare codes, but as I mentioned in the injury chapter, we're not using those for injuries because we have that 7th character extension instead. We also still have our follow-up codes. So follow-up's going to indicate that the injury has been treated, and they're just looking to see if there's any sort of recurrence or anything like that. And you can also use a history code with these. We also still have our donor categories. Counseling codes are in this section. We looked at some of the Z codes in the pregnancy chapter for obstetrical and reproductive services, patients coming in for routine prenatal visits. The newborns and infants, we've talked about a few of the Z codes there. The routine administrative exams, so if patients coming in just for like a physical or something like that, if there is some sort of abnormal finding, then you can use additional codes to specify what those are. There's also kind of a miscellaneous section. Example here is prophylactic organ removal. And then we have some non-specific Z codes that are just kind of generic. And as always, if we can find a more specific code, we want to use that instead. And then the last part of your guidelines just talks about those Z codes that can only be in that principal diagnosis spot. So here's our practice, and I happen to choose, some of these Z codes can be a little tricky to find. I happen to choose one that actually is quite easy. So family history of blindness. Let's switch over to our index. So I'm under history, and then notice family is an immediate subterm here versus going history to personal. And then we had blindness. We have Z82.81. We'll take a look at that in our tabular. So Z82.1, family history of blindness and visual loss. And then when you see this, conditions classifiable to age 54, that's talking about the whatever that blindness or visual loss was in that original family member. So we get Z82.1, and we're done.